Have you here. I'm so looking forward to being in this hour. It's always nice to have great skincare, and we all have our favorites, isn't it true, ladies and gentlemen? But we have something brand new here, Neutrogena Dermatologist. It's only been a couple of visits, so it's my first show, and we're going to be moving along here with Dr. Will Kirby with another great item that we have available for you, and that is the Neutrogena Dermatologist Retinol NX Wrinkle Filler. This one here gets really specific because this is where you're targeting. It might not be the entire face. Maybe yours is crow's feet. Maybe it's the laugh lines. Maybe it's the forehead lines. This is your answer right here. This is instant gratification, but the more you use the product, the better the results you're going to see.
Absolutely. You just summed it up so incredibly well.
I'm going to work for you in your Beverly Hills office.
Thank you. We may have a position open for you soon.
Thank you.
The other product we talked about just moments earlier, that's a full facial product.
Right.
And like you said, you apply that prophylactically or actively to the entire face. This is a targeted product. It's called a wrinkle filler. I call it a wrinkle fighter because that's exactly what it does.
I like that better.
And it's for people who want to proactively really take a really strong first-hand approach with their anti-aging regime and try to tackle some of those deeper lines and wrinkles and creases that really express the aging process.
So is this also, when you would think of it as, in the nicest sense, is it like a beauty product and a skincare product at the same time?
I think that's a great way to think of it. I will tell you this, when we use the phrase beauty product, a lot of times people confuse that with makeup or cover-up, and that is absolutely not the case because this is a bona fide treatment. Neutrogena Dermatologics offers professional level solutions and cutting-edge technology, so you're really getting an efficacious treatment here.
All right, how do we use this?
It's so incredibly simple to use. The product itself is the word I like to use with it is a high level of humectancy. And what that means is that it really provides superior moisturization. And we're going to talk about that in a separate clinical study than the one we referenced earlier. But you can tell a droplet amount there is enough to use for the entire face. But the difference here, as we implied earlier, this is a targeted treatment. What you want to do is you want to take this product, dab, 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 and rub it into any deep wrinkles, creases, lines in your face. Now, there's a couple places in particular that I really, really recommend this product. So let's talk about where people really start to see the signs of aging, and we'll go from top to bottom.
I'm taking notes.
The forehead area is an area where people really overuse expression, and that's where they really start to notice deep wrinkles and lines. So the forehead area is the first place people like to use this. They also like to use it in the glabella complex, which are the 11s in between the brow.
What did you say they were, sir?
The glabella complex. It's a group of muscles.
What it was.
Nerd alert, I realize. We'll stay away from that phrase
You'll
again.
You'll be my phone a friend if I'm ever on Who Wants to Be a Millionaire.
There you go. But that's the area right in between the brow. If you take a good look at yourself in your mirror, have an honest conversation with yourself, look in the mirror and say, do I overuse those muscles? Am I really starting to get deeper lines or wrinkles in that area? And if so, you really need to fight that process because that's an area people often see the signs of aging very early during the aging process. But also the crow's feet around the eyes, the nasolabial lines, which are the lines from the nose to the lip, and then the marionette lines, which are the lines from the lip to the chin. All those areas are areas that we commonly associate with deep wrinkles, and that's where we really, really emphasize the use of this product.
And the more you use the product, the more that you're going to start seeing
the results are cumulative over time.
Okay.
And this also, we'd be doing this a disservice if we didn't jump into and talk about the active ingredients in it. It has that same stabilized retinol technology that I know and that I love because it increases surface cell turnover, but it also has an ingredient in it that I'm incredibly passionate about, and that's hyaluronic acid.
Which doesn't our body produce that?
Exactly. Your body naturally produces hyaluronic acid. It's a clear gelatinous substance, and it really gives a nice turgor, nice lift, a nice foundation to your skin. But as you age, you lose that hyaluronic acid. So if you come to my office in Beverly Hills, one of the options that we have for people is injectable medications, and they're uncomfortable and expensive. They work very well.
I'm not against any of that, but that's still temporary.
Any of those injectables are temporary. That's 100% the case. And when we use those, it's still the same hyaluronic acid.
Right.
The difference here is Neutrogena Dermatologics took that product and formulate it in a manner that you can apply to the surface of your skin and see a clinical result right away.
Now, how do we get that into our regimen? If I'm using the nighttime, I'm using the NX that we had in our first item. How do I get this into
Great question, great segue. The number one way I can answer this is to tell you what I do.
Okay.
So what I do is I use the serum every single night, thin layer to the entire face, and I target any problem areas with this. Not only areas where
you don't have any.
Because I'm doing a really good job. You can use it to actively treat wrinkles or to prophylactically treat areas where you think you're going to get wrinkles. Now there's a lot of confusion out there about the hyaluronic acid, and I like to use this little analogy, the sponge analogy. Hyaluronic acid, true fact, can hold up to 1,000 times its weight in water. So I'm holding a little dry sponge here, and what I want you to do is think of this dry sponge as hyaluronic acid that's contained within this product. And the water here in this little glass is just normal water, normal moisturization that occurs on the surface of your skin. Very simple with this little analogy. We simply add the sponge to the water, add that hyaluronic acid to the surface of your skin, and very, very quickly it starts to absorb that water. The hyaluronic acid, once again, holds up to 1,000 times its weight in water, and that's the exact same thing that's occurring on a microscopic level on the surface of your skin. So this will continue to plump up nicely over the next 10 minutes. That's exactly what that hyaluronic acid does.
And you know, I always use that analogy. You've heard me say this many times if you shop with me, is that it's that grape and the raisin. You know, you take all that hydration out from a grape, you've got a raisin.
Beautiful analogy. I'm going to steal that one, actually. I really
am,
because that's a great way to think of it.
And that's what happens. And as we get older, as everything else slows down, you know, that's why I always say that youth is wasted on the youth, because they don't even scrub their face or wash their face, and they've got these wonderful supple skin. But as we get older, I mean, they exfoliate. It turns around about every 30 days. Whereas we get older, it gets a little longer and a little longer. So, but you know what? When you have solutions, when you have technology and you have products like Neutrogena and Dermatologics working together to make it easier for us. I love the simplicity. We have 2 products in the show here. And you're thinking, does it get any easier than that? Again, take our 30-day money-back guarantee. Now, we've had some viewers calling in to our producer, Kelly, and asking if, and I guess you'd be the expert since you're a dermatologist, if somebody has rosacea and such, can they use this product? What do you recommend?
Well, I'll tell you this. It's not a treatment for rosacea, but by the same token, rosacea patients often have very, very, very sensitive skin. And both of these products are indicated for people with even the most sensitive of skin. So if you have rosacea, you're absolutely allowed to use this product, and most people with that do very, very well.
Okay, perfect. See, again, to me, when any type of, irregular problem to your face, like maybe that little bit of redness or whatever issue that's going on, to me, your skin's talking to you. It's saying so. And a lot of times it could be maybe you're lacking something. But for many of you, if you're not using a skincare, or maybe you're using your skincare, or you're just doing a hit and miss, try it. If you're loving what you're doing right now and you think, you know what, maybe I can raise the bar just that little tiny bit, then try our products that we have here for. Like I said, this is my very first time doing a show with Dr. Will Kirby, and 2 unbelievable products. The first one, and which we'll get back to in just a few moments, but this one here, we're calling, I like what you said, it's a wrinkle fighter, not a filler. Not a filler, because when you think of filler, I'm just thinking of something that's more temporary. This is something that has a solution to your problem.
That's a great
whatever
way
that wrinkle may be.
Great way to think about it. It's a real treatment option, professional level solutions, and that's what Neutrogena Dermatologics provides. It's funny, earlier you mentioned kids and their skin turning over. I'll brag for a second, I have a brand new baby, 15 weeks old.
Congratulations.
Thank you.
Wow.
15 weeks old tomorrow.
You won't sleep for the next 10 years.
Not a lot, but when you look at his skin, it's absolutely flawless. Why? Kids have that increased surface cell turnover. It's going very, very fast. They're growing so incredibly rapidly. I go away for a day, I come back, he's growing, and his skin is doing the exact same thing.
Absolutely.
Unfortunately, as we age, that process slows down, and you lose that luster, you lose that hue, it gets dull, it gets dry, and the way to counteract that is with that stabilized retinol technology to increase surface cell turnover, diminish the look of fine lines and wrinkles. Give yourself a more beautiful, youthful appearance to your skin.
And you know what? This isn't a brand new product here that Dr. Will Kirby brought to you, but it does have clinical studies, everybody. Take a look
Absolutely.
here.
And this clinical studies here, once again, very, very powerful. 70% of users showed improvement in the appearance of crow's feet and fine lines after just 1 application. Exceptional hydration lasting up to 24 hours. At 4 weeks, 90% of users, 90% showed improvement in the appearance of crow's feet, fine lines, and 81% of users showed improvement in the overall appearance of their skin. They noticed overall younger looking skin, 81% after 4 weeks. And once again, the rules of the skin still apply. Adults, 35 to 57 days is the normal skin cell turnover for an adult. So what do we want to do?
Almost 2 months.
It's almost 2 months, and that's why the clinical studies are done 4 weeks and 8 weeks, because what we want to do is shorten that time. We want to increase that surface cell turnover so your cells are replicating much, much faster.
And you know what? You won't see results if you're not using the product.
Oh, that's... please say that again. So many people come to my office, they have a product that they purchased a year ago, they still have 95% of it in the bottle, and they say, listen, this isn't working for me. And I said, well, one, you're not using it. Why are you not using it? And they say, well, it didn't work for them. Throw it away.
I've had viewers that I've met, and even when it comes to fitness equipment, says, well, you know, I says, well, have you, well, I haven't taken it out of the box yet. Well,